Welcome back to Surgeon Simulator. We are gonna do ingrown. Sorry, we're gonna do ingrown toenail removal. Don't ask why I'm getting excited. You're gonna see something stupid now. Pop up. So I need to know their faces. You see. Weird. My phone's offline. Totally.
Hello, and
Hi.
welcome to Surgery Squad's virtual ingrown toenail removal. I'm Dr. Jeff,
Hi,
and
Jeff.
I'll be guiding you through this procedure today.
Yeah, we're sorted.
An ingrown toenail happens when the edge of the toenail grows down and into the flesh of the toe. When this occurs, there is usually a moderate amount of pain, redness, and swelling around the toenail. An ingrown toenail is usually caused when extra pressure is applied to the toe due to shoes that are too tight or too loose. Improperly trimmed toenails, foot or toe deformities, injuries, and fungal issues can also be contributing factors.
He's got airy feet like me.
There are some ways to treat an ingrown toenail at home to relieve some of the pain. But remember that you should never attempt to remove an ingrown toenail yourself.
No, don't.
If you're a diabetic and have an ingrown toenail, it is recommended that you go to the doctor immediately.
And see him in about 2
Now that
weeks'
you
time.
understand the causes of an ingrown toenail, let's put on our gloves and remove one.
Yeah.
Our patient is ready, so let's begin by disinfecting the toe.
Disinfected the toe, disinfected the toe, disinfected the toe. Why ain't working? Oh, I'm gonna drag it. We're still gonna walk home. We're gonna pay the whole foot. All foot. All foot. All of the foot. Well, basically now we don't need to literally disinfect. Do we literally need to disinfect all toe? I mean, seriously? Do we have to disinfect everything? I mean, mine's it forever, this. My flash players are down at the moment, anyway. Because it's a moron. Been playing up on me all day. I've been trying to do recording, and it's for some reason it's literally yesterday. I played some games and pre-recorded, and it was fine then. Yep. Make sure it's all focused. He wants a damn good job. Just getting your foot a
Now,
time.
we need to numb the toe with a local anesthetic. We'll have to inject the anesthetic in several locations around the toe.
Yeah. Puff. 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 I hate needles. I hate
Great. Now we'll wait a few minutes for the toe to get numb.
Yeah.
Now that our patient's toe is numb, place the special tourniquet around the toe. This will help reduce the amount of blood coming from the wound. Once you've done that, we can move on to removing the ingrown portion of the toenail.
I'm gonna make you listen to it all.
First, carefully slide one blade of the nail anvil under the affected nail.
If you're eating dinner and watching this, we've got a big stomach because it's about to go in.
We're going to go down the nail until we feel a little bit of resistance. Our patient's going to feel some pressure as we cut away the ingrown nail.
Do we have to do it? I don't want to play no more.
Great! Take the forceps and carefully remove the ingrown nail.
Oh yeah. Oh, I had to drag it.
It's getting kind of messy in there.
You don't
Let's
say.
clean up that blood.
I thought it were a click one like this. Quick, click, click, click.
See that small bit of pale yellow substance right there?
Infection
It
in it.
looks like the patient has a bit of infection in the toe.
Ew.
Firmly squeeze the edge of the toe to get as much of that infection out as you can.
That is nasty. I know this is just a toe. like,
That
but-
toe is starting to look much better, but we're not done yet.
No,
Next, we're going to apply some phenyl acid to the wound. This will help ensure that the problem of ingrowth will not reoccur in this toe. When you're done inserting the acid, I'll remove the tourniquet and we'll finish up.
acid is bad. It's the sound. It's
Finish by applying some antibiotic
Weird.
ointment on a sterile gauze pad.
Well,
Place it against the toe and wrap it in a gauze bandage. Fantastic job!
so far.
Since there was some obvious infection,
Anodine.
our patient will be sent home with a prescription for some antibiotics.
Antibiotics.
We'll also need to tell our patient to
Antibiotics.
keep the wound dry,
Keep the
clean
wound
the
dry.
wound regularly, and replace the bandage 2 to 3 times a day.
Yeah.
While our patient's toenail isn't likely to regrow, his condition is likely to return if he doesn't take care of his feet. This includes wearing proper fitting shoes, properly trimming his toenails, and keeping his feet clean and dry. And that's how we remove an ingrown toenail. You did a great job today.
I know.
While you're here, try your hand at one of our other surgeries here at surgerysquad.com.
Learn about consumer. No, I'm not doing that. I'm back with surgery squad. Sorry, I'm back with surgery squad. I'll be on A10. Back in a second. I saw this one. I thought, you know what, bog it. We'll go for it. I've no idea what it is. It's visual NDACI. I don't know how long it is, by the way. So it could be from 20 minutes, 40 minutes, 80 minutes. I have no idea.
Hello, and
Hi.
welcome to Surgery Squad's virtual adenoidectomy. I'm Dr. Susie, and I'll be guiding you through this procedure today.
Brilliant.
Our adenoids are located at the back of the throat, just below where the nose connects, also known as the pharyngeal tonsil. They are part of our immune system because they protect us from the bacteria or viruses that might enter the body when we breathe or swallow. They are more important for children than adults, and they shrink as we get older. In some adults, they become inflamed, which can lead to infections, sleep apnea, better known as snoring, and ear infections, since enlarged adenoids might block the eustachian tubes, which drain fluid from the ears into the throat. Normally, these symptoms can be treated with antibiotics, but when these infections occur more frequently, we perform an adenoidectomy to remove them. Having an adenoidectomy, if it is required, can reduce the number of ear infections, reduce recurring chances of sinusitis, and can alleviate sleep apnea. However, there's a risk of developing an infection at the removal site. Plus, the procedure might not alleviate all the problems associated with adenoids. For instance, if ear infections continue, the problem might be elsewhere. Our patient today experiences sleep apnea and ear infections. Let's scrub in and get to work.
Let's call him John.
We'll need to use a general anesthetic for our patient. Why don't you help out? Can you find a suitable vein in the patient's hand?
Ain't this like what's it called now? Tonsil surgery. Under your tonsils. Isn't this just like that? Right, everyone. I'll be back in a jiff. I'm just gonna shut the window because make sure neighbour's doing some work outside. And if he's banging about and that, I don't want it to be on the recording. No, dropped a lot then. It's alright, I end up going downstairs for a drink and everything, doing everything else. Hey, I'm back. Right, where were we? Click.
Looks good to me. Sterilize the injection area using a sterile alcohol wipe.
Sterilizing. We're sterilizing people! Oh, click. Remember to click. You gotta click on these things, you know. You gotta make sure. Oh, for God's sake. Oh, right, I just clicked the thing. Stupid. Pardon me.
Insert the needle and advance the angiocatheter into the vein.
If you see me take a drink a few times, my throat's gonna be very dry. So I do apologise.
The small burst of blood in the angiocatheter hub is what medical professionals refer to as a flashback. This lets us know that the angiocatheter is correctly positioned in the patient's vein. While placing a small amount of pressure over the vein to collapse it, remove the needle. This will reduce the amount of blood that may discharge out of the angiocatheter when the needle is removed.
So click to get rid of the needle.
Now that the needle has been removed, I'll dispose of it in a sharps container. We need to secure the IV with tape and test the line. Great! Now we'll wait a few minutes for the anesthetic to take effect.
Yeah. 10 minutes later, not 5 minutes later, 10 minutes later.
One more thing. Since we'll be working in the patient's nose and mouth area,
Yep.
we'll need to make sure he can breathe. Let's insert a breathing tube into one nostril.
Breathe into. Ooh. I have to keep walking. It's in the surgery. What a spot? Not the spot. Right, what? Yeah, whatever.
Great job! Our patient is under and breathing. Now we're ready to remove the adenoids. We'll begin by putting an endoscope through our patient's nose so that we can view our work on a monitor. When we reach the back of the nose at the entrance to the throat, we'll be able to see the adenoids. Okay, good. Now we can see the adenoids. We need to open the mouth and get the tongue out of the way so we can begin our procedure. To do that, we'll use a special retractor that opens the mouth, depresses the tongue, and locks into position.
Oh, record's offline. I didn't realise. Sorry about that, people. We didn't. We were there. Sorry about that, people. Sorry. What?
Great work! We're going to remove the adenoids using a device that uses suction
That guy
cutlery.
from Sparta,
The device uses electrical
That's
pulses to
Sparta!
liquefy the adenoid, then suctions the liquefied adenoid out. This method is faster and results in less bleeding.
Go on. This is at me back of your throat as well. You know what I mean? It's all at me while you're on that. Oh, Fino, I could just do it all in one. So I do about 6 parts. It's the sound. I don't like the sound. I should have edited this bit out. No, sure. Oh, Fino, fire. Sorry, I edited this bit out. Oh, that is
Fantastic!
messy.
The adenoids are gone. Now all we have to do is remove all of our equipment and get our patient to recovery.
Is that it?
Our patient is in recovery, and he'll be able to go home in a few hours once he can breathe easily, cough, and swallow. We'll prescribe some antibiotics, and once he gets home, he needs to drink plenty of water to keep hydrated. He'll also need to stay away from solid foods, but he'll get to eat ice cream, sherbet, popsicles, and jello for a couple of days. He might experience a burned taste in his mouth, which will subside after a couple of days. He should brush his teeth often to help alleviate that taste. Scabs might form in the back of his throat from the surgery. And, of course, he should contact his doctor if there's bleeding or excessive pain from where the adenoids were removed.
So yes, we've seen about
You
3
did a
weeks.
great job today. Try your hand at one of our other surgeries here at surgerysquad.com.
Oh, I did that ventil. Oh, did I? Did I do ventil crown? I can't remember what I did now. I've been able to research back in my old videos. Yeah, I did. I think I did that. I wanted one of the other videos what failed. Well, when I was talking. I actually thought mic went down. It went. Actually, my mic switched on. Oh yeah, so. Me, sorry, I'm doing a lot of burpee. Passing gas on YouTube. Yeah. So that's how you do that. This is hair transplant. I did this in another video, but it failed. So I might as well do it again, so I know what I'm actually doing. Which is weird.
Welcome to Surgery Squad's virtual hair transplant.
Hi.
I'm Dr. Susie, and
Hi,
I'll be
Susan.
assisting you with this surgery today.
Yay!
A hair transplant is an outpatient procedure that involves transplanting hair follicles from one part of the body, known as the donor site, to the balding part of the body, known as the recipient site. Although hair transplantations are typically used to treat male pattern baldness and restore eyebrows, beard, or chest hair, they can also be used to fill in scars caused by accidents or surgery. Today we'll be using the strip harvesting method to treat our patient's
Looks like
male pattern
Michael, grab a
baldness.
photo.
Strip harvesting involves removing a small strip of scalp from the donor site under local anesthesia and transplanting the pieces or grafts of the scalp into the recipient site of the patient's head. Before the surgery, our patient was advised by his doctor to avoid using any medications that may result in a poor take of the grafts. These medications include, but are not limited to, aspirin, ibuprofen, and antacids. Alcohol use and smoking before and after the surgery can also result in poor graft survival. To prepare our patient for the procedure, we'll need to first shampoo his hair with an antibacterial agent to help prevent any infection. I think you can handle that.
Oh, for the love of God. You know, I am now a hair salon now. Did any of you remember when games used to be fun? You know, when they were all gruesome and everything else, and I don't even know what the hell I'm talking about. This is taking forever. But you know, we're gonna do the job right. We're not gonna make a mock of it. It's Michael from. We're gonna call this guy Michael because he reminds me of Michael off Grand Theft Auto. So we're gonna do the job right. Can't just do one little tiny bit, or they might get Trevor and Franklin come after me. Mind you, I throw Grand Theft Auto. I like Trevor most. Psychopathic murderer. Well, that's one nice hair. Let's do. You see, I am now a beauty salon. Oh, missed a bit. I have no idea what the hell. But to click and drag. Work all good leather. Oh, you're just doing that with your hair. Basically. Oh, I've done them all. Oh, forget. Done.
So
Yeah.
fresh and clean. Thoroughly rinse the patient's hair and we're ready to get started.
Look at this. I am now. His hair is going to be so spotless. That's just going to be so spotless that he's going to get all the ladies to like him. He's going to get everybody to like him. I like him. You like him. Well, actually, I actually don't know if you actually like him. Oh, yes. I like that sound's just gone down. We'll do a good job. Yep, I'm up for that.
The next step is to define our patient's target hairline.
I've just
Go
dyed his
ahead and
hair.
outline where we want the patient's hairline to be.
Oh. Hi. Look at that. No, I better not put that. No. just start struggling there, you know what I mean? We don't care where it goes. Alright. Line is start from there, let's go along there.
That looks good to me. Let's prepare the donor site. We'll begin by trimming the patient's hair in that area.
Oh yeah. Look at this. See? I'm a beauty salon. Sorry. I ain't bought by my cam yet. Look at that. Fucking instrument. You happy with that? I'm happy with that.
Now that the patient's hair is trimmed down, we'll need to mark the area that we'll be removing.
Oh, yep. About up there. Yeah, about there. And out there. Yep.
Great job!
I know. So
Inject
far.
local anesthetic into the marked injection sites to reduce the amount of discomfort our patient may experience.
Oh, wow, no, that's that. Perf. See, I know these things. I know how to do this. I did this in...
Great! He won't feel a thing.
Good.
Now we'll need to
Let's
remove
bash
the
his
piece of
brains out.
scalp we outlined from the donor site. Use the scalpel and cut along the line to begin the process.
It could be like Left 4 Dead, innit? All we wanna do is eat Michael's brains. We're not unreasonable. I mean, no one's gonna eat his eyes.
Next, we remove the piece of scalp from the donor site.
Yeah.
Make sure you have a good grip.
Yeah, make sure you got a good grip. Oh, I have. Oh.
Once removed,
God.
we'll prepare the piece of scalp for grafting by dissecting the individual follicles. But before we do that, why don't you go ahead and suture the donor site?
Yeah. So what we do is we do this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Yeah, I'm counting. I've lost count now, so. Is this how I actually do hair transplant? In my hair goes along straight and it goes up there. He's like a spaz sack. I wouldn't reach for this guy, people.
Great, let's get to some dissecting.
Yeah.
The first thing that we need to do is cut the removed scalp into sections. We'll dissect this one section of skin while our medical assistants take care of the others.
Oh, look.
Let's remove the individual follicles from the donor material using a pair of tweezers and a sterile razor.
Oh, yes. Look at this. We're doing proper work now. 3, 4.
Nice job!
Oh.
This step is repeated thousands of times to get each follicle prepared. I'll have my assistants finish up.
Oh, right. That's
To
it.
prepare the recipient site, you'll need to first inject a local anesthetic into the scalp. We don't want our patient to be uncomfortable.
Well, no, obviously not. I mean, we want to touch this guy.
Now we need to make tiny incisions into the recipient site so that we can place the grafts into the scalp. Use the microblade to make the incisions in the recipient site.
Oh, I'm gonna say.
Perfect. With all of the incisions, it's getting a little messy there. Let's get that cleaned up.
Yes. Let's get it all nice and clean. So clean I can see my face in it. Look at that. Sorry. Look. Oh, a bit there.
Much better.
Hell yeah.
Use your tweezers to pick up and insert the hair grafts into the recipient area.
Oh, Jesus. Where? Oh. Nice and quick, lad, as quick as I can. Yes. At least I don't have to do them all. Mind you,
You're a natural.
I know.
Now that you've got the hang of it, we'll repeat these steps for the remainder of the recipient site.
I mean, that takes long,
After
doesn't
the
it?
procedure has been completed, our patient will be prescribed antibiotics to prevent wound or graft infections. For up to a week after the procedure, the donor area may be sore and some numbness may be experienced as well. Our patient can also expect moderate swelling and redness during this time. Shampooing of the recipient area is typically started 2 days after the surgery. This is important as it prevents scabs from forming. If scabs do form and are left to bond to the hair shaft, the newly transplanted hair follicles may be lost. In about 10 days, our patient will return to have his sutures removed. During the first few days after surgery, almost all of the transplanted hairs will fall out due to shock loss. Shock loss occurs when the hairs are traumatized by their relocation. Within 2 to 3 months, the patient can expect new hair to begin to grow from the treated area and continue to thicken during the following 6 to 9 months. And that's hair transplant surgery.
And that's it.
Why not try your surgical skills in another surgery here on SurgerySquad.com?
And I am fine because I have already done them too. And that's it for Surgery Simulator for now. Until I can get me out into gear and actually get the game of proper Surgery Simulator. Anyway, that's all. That's all I'm doing. Nothing else. There's nothing more to it. So anyway, hang on, how have we recorded? I don't know. I think it's like a 30-minute damn video game. Anyway, thank you all for watching. Click all the rest of the crap I've done. I've been watching some of the old videos. You know, when I first did Vanish, first did Dungeon Nightmares. I've not completed Dungeon Nightmares yet. What else did I do? Not time or I can never say or Vitary or whatever the bloody hell it's called. I keep calling it Arbiter. But anyway, Thank you for watching, and I will see you in the next episode. Bye bye. I can't find the button again. I cannot find the button. Poof.